everyone, I'm Dr. J.S. Kahlon. Today topic I'm going to discuss with you is the coronavirus that we also called COVID-19 and the novel coronavirus. क्योंकि पिछले 2-4 दिन से पेरेंट्स एंड स्टूडेंट्स आर कीप टेक्सटिंग व्हाट इज गोइंग टू हैपन, क्या होगा, एंड द पेरेंट्स आर गेटिंग पैनिक बिकॉज इन यूक्रेन सम 3 or 4 some cases are found of the coronavirus and three persons almost dead. So the thing is that first of all students, you don't have to get panics, and parents also आपको बिल्कुल चिंता करने की जरूरत नहीं है, because now the most important points and the most 2 things you have to do: keep yourself isolated and make your social distancing, wash your hands properly with the soaps and with the sanitizers, as I keep updating on my Facebook page what you have to take the precautions. So what is coronavirus? The coronavirus or the novel coronavirus, the name we say because it's the first time newly identified the virus. Okay, it's originated in the Wuhan province, Hubei in China. If you going to see what is the source of this coronavirus, the main source of coronavirus is mostly scientists or doctors thinks this is animal originated, because mostly the reported case, जो केस रिपोर्ट हुए थे चाइना में, मैक्सिमम थे वर्क इन सी फूड मार्केट और द एनिमल मार्केट. What are the symptoms of a coronavirus? The main symptom of coronavirus is cold, flu or fever, or you have respiratory illness like shortness of the breath or difficulty in breathing. These are the main common symptoms of coronavirus, but you can also counter in some patient is sick or the patient is aged, so they have sometimes chest tightness or chest pain also, and rhinorrhea in some cases, also diarrhea can come, but these cases are very minimal because 70 to 80% cases are a mild and the patients and the affected person can recover very easily. Okay, how does this virus spread? It's a mainly droplet infection and it's mainly spread by the sneezing and the coughing, same like influenza and a flu viruses. Is there any vaccine available right now? There's no any vaccine available for this virus. And how you can protect yourself, this is the most important point. You can protect yourself, as I told you, make social distancing. Okay, अभी कोई भी काम करने की इतनी ज़रूरत नहीं है कि आपको बाहर जाना है या पार्टी अटेंड करनी है या एक्सरसाइज करनी है या जिम में जाना है. दीज थिंग्स वी कैन डू लेटर ऑन. ओके, यू हैव रूम. ओके, यू कैन कीप स्टडिंग, यू कैन डू सम योर रूमी एक्सरसाइज. दिस इज एडवाइस फ्रॉम माई साइड्स and also from the Mayomd teams and from the university sides. Okay, सो पेरेंट्स को मैं यही कहना चाहता हूँ, देखो एज़ कम्पेयर टू इंडिया अभी काफ़ी अच्छी यूक्रेन में सिचुएशन है, क्योंकि उन्होंने अपने बॉर्डर क्रॉस कर दिए थे ये सिचुएशन आउटब्रेक होने से पहले. सो इफ़ वी हैड गो ऑन द डाटा बेस, सो इन इंडिया ऑलमोस्ट 300 cases are found. Okay, that is actively COVID-19, and 23 is recovered and 5 deaths are confirmed. Okay, and if we compare with the world database, and almost 3 lakh people are affected and 95,000 people is almost recovered and almost 13,000 death is confirmed. So why I am telling you this data, because you see how much is deadly. And if we are talking about Wuhan city, so within 4 days there are thousands of people are got affected within 4 to 5 days, and city got locked down. As if we talk about the incubation period, so incubation is periods around 0 to 24 days and 0 to 40 days if we are taking it a median. So in this case, the 80% people no need to get hospitalized. Okay, because they are with the mild symptoms like just cold, flu or some difficulty in the breathing. So if these mild symptoms just go from the mild to severe, then we need to hospitalize these patients. Okay, because in severe cases the patients has a difficult in breathing. Some cases from this 14 to 50% severe cases, the 5% cases are going to critical, and almost 2 to 3% people are getting died. So you see how much is deadly. Okay, so we have to cure. अभी जो स्टूडेंट्स हमारे पढ़ रहे हैं उनको ज़्यादा किसी चीज़ के लिए पैनिक होने की ज़रूरत नहीं है. जस्ट स्टे आइसोलेटेड बिकॉज यूनिवर्सिटी गिविंग यू गाइडलाइंस, वी आर गिविंग यू द गाइडलाइंस, we are here the sport team. Okay, as in Ternopil or Ushkorat we are giving the mask, okay, have you seen? And so no need to worry, just stay isolated, no need to write mails to the embassy that arrange for us, because if you are going to travel you are more prone to getting infected. So the best things you have to do, stay isolated. And same message to the parents, आपको पैनिक होने की ज़रूरत नहीं है, आप भी आराम से stay isolated, stay at home, क्योंकि जितना ज़्यादा आप पैनिक होंगे उतना ज़्यादा ही the things will get worse. Little about I'm going to discuss about with the structure of this virus. You know, virus is made of RNA and it's coated with the proteins, and this coronavirus have a spikes like a crown. That's why we call this virus crown or coronavirus, okay, and COVID-19, okay. And why we are telling that get the social distancing, because the life of this virus, if it's staying on the surface, is almost 10 to 12 hours. If you are getting isolated, you are making the social distancing, and the virus is not going to spread. So we can stop this chain, or we can break this chain, और हम इस chain को आराम से break कर सकते हैं, and we can win this game. So as I advise you, stay at home. So the next things I want to discuss with you about the structure of this virus. Okay, this is single stranded RNA virus, and it's have enveloped with the lipid layer and with the protein layers, and he got spikes that is made of a glycoproteins. Okay, and here I want to highlight one point why we are telling that wash your hand properly, wash your hand regularly, because the soap proteins and the alcohol particles is going to attach the lipid layer of this virus, and they are going to rip off this virus, and that this virus is finished. Okay, so this virus is dead. Okay, and so with the help of these glycoproteins, and it's attached to your cells whenever it's put by the nose or go inside of your throat, and he got more keys as compared to like a flu or influenza or the SARS virus. Like if a flu or influenza or SARS virus have a 2 or 3 keys, it got almost a 10 to 20 keys. Definitely if any thief have a 10 to 20 keys, they can open your door, or here is this virus is going to open your host cells and enter inside your bodies and going to get copied or the multiplied. So this was about the structure of this virus, how it's going to enter inside your body. Okay, so why we are saying this, make a social distancing, because this virus is a very deadly and very dangerous. Here one thing is again I want to highlight, okay, why we are telling that make the social distancing, because outbreak of this virus is a very fast, it's spreading very fast. Okay, if we make the social distancing, we can break this chain, हम इस chain को तोड़ देंगे, and this outbreak can be slow spreading, and the persons who got sick or ill, they recovered, and if the new persons are coming, the healthcare system have or have proper manpower to take care of this new coming patients. Okay, so in the last I want to highlight 3 or 4 points. Okay, don't get panic, stay in the presence, and just concentrate on your personal hygiene and make the practice hand washing good. Okay, make the keep proper hand wash and make it social distancing, that you guys are not going to affect, and you are not going to affect your parents or your children at home. Thank you, and thanks for watching this video.
Don't forget to subscribe to get latest update for study MBBS abroad, and bell icon for notifications. Thank you and have a nice day.